This morning in Health Watch, the H1N1 vaccine. It is now being rushed out the door to clinics all across the country, according to the CDC and the distributor. If the vaccine is being rushed out the door, will it arrive by early October as expected in doctors' offices?
Well, it will start to, but this does not necessarily mean that you would be able to get it from your doctor starting next week. There are significant logistical issues that are at play here, and in speaking to numerous government health officials, they say we can anticipate possibly a little bit of a bumpy ride.
As the H1N1 vaccine continues to trickle out, at the few clinics that are open, the only thing bigger than the lines is the frustration.
I want to punch somebody. We've been here a long time, and my kids are going crazy. But if I would have known it would take this long, I would have taken my kid home and actually gotten a good nap out of this whole thing.
After months of urging people in priority groups like children and pregnant women to get the vaccine, the CDC acknowledges that the vast majority of them cannot.
We're nowhere near where we thought we'd be by now. We're not near where the vaccine manufacturers predicted we would be.
No, I don't have the shot, but he has the shot, and I feel a lot better. That's why I waited in a line for 5 hours.
5 hours?
5 hours.
Many clinics, like this one, limited their supply to those most at risk: babies, young children, and pregnant women. The Centers for Disease Control says H1N1 has spread to 46 states. More than 1,000 Americans have died, and more than 20,000 have been hospitalized. So much like a disaster declaration before a hurricane, the president today declared the swine flu a national emergency. The White House says it's not meant to scare anyone. It simply loosens some bureaucratic red tape to make it easier for hospitals to get what they need should the epidemic get worse. Delays in producing the H1 vaccine means some of the children we saw getting shots today may have trouble getting the recommended second shot a few weeks from now. The White House said there'd be 120 million doses of the vaccine available by this fall. They've cut that prediction to 50 million doses they hope to have ready by mid-November.
The demand for the H1N1 vaccine continues to outstrip supply. Nationwide, only 11 million doses have been distributed, not the 120 million federal health officials had expected to have by now. The virus seems to target young people. 100 children have died so far this year.
46 states are reporting H1N1 as widespread, with more than 1,000 deaths and 20,000 hospitalizations. And while an average case is usually no more dangerous than other flu, this strain has its unknowns. 30% of the deaths are in healthy people with no underlying problem.
What do you say to families who've gone, waited, couldn't get the vaccine? What do you want them to do for these days?
I want them to come back. I hope that people aren't discouraged, and I know it's frustrating to wait in line, and particularly if you end up with no vaccine.
I know concern has been expressed that 4 out of the 5 of the manufacturers of the vaccine are overseas, not in this country.
That's right.
How did this happen, and should it be changed?
Officials from the Obama administration called for patience today as people wait and wait and wait to get the flu vaccine. Health and Human Services Secretary Kathleen Sebelius defended the government's response to the virus, saying it is more robust than ever in the history of this country.
There are faster, more reliable ways to make vaccines that some companies insist could have been ready by now. The Connecticut company has already produced 100,000 doses of the new H1N1 swine flu vaccine, but it's being tested for safety and effectiveness in Australia, not in America.
Why didn't you test the vaccine here in the U.S.?
It's because the U.S. government wouldn't pay for the trials, and the Australians did.
Leaving Americans today with one less resource in the race to make vaccine.
I was in the White House in 2009, 2010. I was working for Vice President Biden. I wasn't involved directly in the H1N1 response, but I lived through it as a White House staffer. And what I will say about it is a bunch of really talented, really great people working on it, and we did every possible thing wrong. And it's, 60 million Americans got H1N1 in that period of time. And it's just purely a fortuity that this isn't one of the great mass casualty events in American history. Had nothing to do with us doing anything right. It just had to do with luck.